First aid and safety. We all observe that when individuals fall ill or are injured, they are taken to hospitals or doctors for treatment. But it takes time to reach them, during which if some initial care is taken, it helps treatment of such individuals and in many cases saves their lives. We also observe that some of the minor illnesses or injuries are cured by taking such initial care. However, this care cannot be taken unless we are aware and trained in first aid. In the present lesson we shall discuss various aspects of first aid and safety. What does first aid mean? First aid is the provision of initial care for an illness or injury. It is usually performed by a non-expert person to a sick or injured person until appropriate medical treatment can be accessed in a hospital or by going to a doctor. Certain self-limiting illnesses or minor injuries may not require further medical care after the first aid intervention. It generally consists of a series of simple and in some cases, potentially life-saving techniques that an individual can be trained to perform with minimal equipment. The first aid training, therefore, is of value in both preventing and treating sudden illness or accidental injury and in caring for large number of persons caught in a natural disaster. It is a measure both for self-help as well as for the help of others. If you, as a first aider, are prepared to help others, you are better able to care for yourself in case of injury or sudden illness. Even if your own condition keeps you from caring for yourself, you can direct others in carrying out correct procedures to follow on your behalf. Having studied first aid, you are prepared to give others some instruction in first aid, to promote among them a reasonable safety attitude and to assist them wisely if they are stricken. There is always an obligation on a humanitarian basis to assist the sick and the helpless. There is no greater satisfaction than that resulting from relieving suffering or saving a life. The main objective of first aid is not to cure, but to ensure safety until the patient or affected person accesses specialized treatment. It is the initial assistance or care of a suddenly sick or injured person. It is the care administered by a person as soon as possible after an illness or accident. It is this prompt care and attention prior to the arrival of the ambulance that sometimes creates the difference between life and death, or between a full or partial recovery. The major objectives of first aid are, I. To ensure that the victim reaches the place of specialized treatment safely and life is not lost in between. E. To prevent further harm, i.e., the injury that has taken place does not deteriorate further. E. To prevent the danger of further injury, and IV. To promote recovery, i.e., necessary intervening care is taken in a way that promotes recovery and relieves the victim of pain and uneasiness. But before providing first aid in different cases, it is essential to know and be trained in the art of providing first aid. Though it is done by non-expert persons, it cannot and should not be administered without acquiring adequate knowledge and appropriate skill. There are different ways of providing first aid in different cases of accidents and illnesses. Let us take some specific cases and know how first aid is provided. First aid for drowning. As many deaths occur because of drowning. Death by drowning occurs when air cannot get into the lungs because of the entrance of a small amount of water into the lungs. This may cause the contraction of the throat. In such cases, efforts are made to remove water from the stomach of the drowned person. Attempting to forcefully remove water from the victim's stomach should be avoided, as this may make the victim vomit and there are chances of casualty. A casualty from drowning needs to be treated by a medical doctor, even if he seems to recover, because there is a possibility that a secondary drowning may occur in him at a later stage. In this particular situation, the aim of the first aid is to restore breathing, to keep the person warm and to arrange for taking him to hospital. The following steps may be taken. Step 1. Rescue the person and get him to the dry land. Keep the person's head lower than the rest of the body to reduce the risk of inhaling water. Step 2. Lay down the person on his back. Open the airway and check breathing. If required, give CPR, cardiopulmonary resuscitation, with chest compression. Step 3. Treat the person for hypothermia, low body temperature, remove wet clothes and cover her with dry blanket. If the person regains full consciousness, give him a warm drink. Step 4. Call for a doctor or ambulance to transport the person to the nearest hospital as soon as possible, even if he appears to have recovered fully. Now we will look at the first aid for fire injuries. When the skin comes in direct contact with fire, it gets damaged. This is known as dry burn. The burn exposes the underlying part of the skin, which increases the chances of infection. While assessing the burn, it is necessary to consider the circumstances in which the burn has occurred. Then establish the cause of the burn. Observe the condition of the victim. Does he need immediate medical attention? Then assess the extent of burn or the depth of the burn, and determine the degree of risk for infection. Based on the depth of the skin damage, the burns are categorized into 3 types. A superficial burn involves only burns on the outermost layer of the skin, called the epidermis. A partial thickness burn is generally very painful. This destroys the epidermis. If such wounds are on more than 20% of the body, then it may be fatal. A full thickness burn is not painful in most of the cases, so it may mislead the first aider and the casualty about the severity of the injury. This needs immediate medical attention. As the kind of the burns vary, so does the kind of first aid needed for various kind of burns. First aid for severe burns. In this case, the first aid is given to stop burning and relieve pain, treat the associate injuries, minimize the risk of infection. In case of severe burn, the following steps need to be taken. Step 1. Do not allow the injury area to come into direct contact with the ground. Step 2. Pour cold water on the burn for a minimum of 10 minutes, but at the same time, arrangement of transport for taking the casualty to hospital should be made. Continue cooling the affected area until the pain is relieved. Step 3. Gently remove any ring, watch, belt and shoes before the tissues begin to swell. Carefully remove burnt clothing, if it is not sticking to the skin. Step 4. Cover the injured area with a sterile dressing to protect it from infection. Step 5. Gather and record details of the injury. Record the level of response, pulse and breathing carefully. Step 6. While waiting for the help to arrive, keep reassuring the casualty. In case of burn of the face, do not cover the injury because it may cause discomfort to the victim. Keep cooling the area till the doctor arrives. First aid for mild burn. In case of mild burns, first aid is given to stop burning, relieve pain and swelling, minimize the risk of infection. In case of mild burns, one should, Step 1. Pour cold water on the injured part for minimum 10 minutes to relieve pain. If water is not available, then any harmless cold liquid, for example, milk, may be used. Step 2. Remove gently any ring, watch, belt and shoes before the tissues begin to swell. Carefully remove burnt clothing, if it is not sticking to the skin. Step 3. Cover the area with a sterile dressing and bandage loosely on the affected area. Step 4. If a blister is caused by the burn, apply a non-adhesive dressing that extends well beyond the edges of the blister and keep it in place until it subsides. Transporting the person for medical help. After giving first aid, medical evacuation of the sick and wounded is the responsibility of the medical personnel who have been provided special training and equipment. Therefore, unless there is an emergency, wait for some means of medical evacuation to be provided. When the situation is urgent and you are unable to obtain medical assistance or know that no medical evacuation facility may be available, you yourself will have to transport the casualty. For this reason, you must know how to transport without increasing the seriousness of his condition. Thank you.